Welcome to Wellness Check, your one-stop destination for optimizing your well-being and finding inner balance. Join me each week as we explore a wide range of wellness topics, from mindfulness and self-care practices to fitness routines and nutritional guidance. Together, we'll unlock the secrets of living a vibrant and fulfilling life. Learning that someone experienced a stroke is always an alarming and frightening experience. A stroke can have severe effects on the entire body and, in some cases, can be fatal. It occurs when the blood flow to the brain is suddenly interrupted, leading to the death of brain cells in that affected area. That is why stroke is often referred to as brain attack. Taking prompt action and seeking emergency assistance within the first hour of symptoms is crucial to minimize the potential damage or prevent a tragic outcome. To better understand the early signs of a stroke and more related information, today's video will delve into this topic and provide valuable insights. But before we continue, please don't forget to like and subscribe to our channel. Number 1. Being unable to walk. Individuals who are about to have a stroke can exhibit various symptoms, and one important sign to watch for is difficulty in walking. Some people may appear perfectly fine while sitting and conversing with others, but as soon as they attempt to stand and walk, their ability to walk properly may be compromised. This lack of coordination among their limbs can be an early warning sign of a stroke. They might also experience weakness in one of their legs or have trouble standing upright. If you observe any of these signs in a person, it is crucial to seek medical attention immediately so that a healthcare professional can assess their condition and determine the appropriate course of action. During a stroke, a part of the brain is affected, disrupting normal brain signals. This results in a struggle between the brain and body to coordinate limb movements. It's as if the brain and muscles are no longer in sync, causing tightness in the muscle and making it difficult to stretch limbs. A clenched fist could also be an indication of this disruption. It's worth noting that the way we walk isn't just a reflection of our health at a particular moment. Over time, the simple act of walking can significantly impact our overall health. Number 2. Paralysis. When paralysis occurs as a result of a stroke, it can manifest as weakness or the complete inability to move one or both sides of the body. One visible sign of paralysis from a stroke is a droopy appearance on one side of the face. To confirm this, one can ask the person to smile and observe if one side of their face remains droopy and unresponsive. Another indication of stroke-induced paralysis is the person's inability to lift their arms properly. They might also experience stumbling and difficulty in maintaining balance due to the loss of control over their limbs. Paralysis resulting from a stroke doesn't always mean a complete loss of movement. Some individuals may feel a tingling or prickly sensation in their skin, often described as pins and needles, which is a consequence of nerve damage. The duration of paralysis after a stroke can vary significantly from person to person, making it challenging to predict how long it will last. In such situation, it is essential to stay calm and ensure that the affected person is in a comfortable position. Keeping them conscious and maintaining communication is vital. Monitoring the person's vital signs, such as breathing and pulse, is another important step. However, it's crucial to avoid giving them anything to eat or drink until a medical professional assesses their condition. Swallowing difficulties are common after a stroke and could lead to a choking if not handled properly. Therefore, seeking immediate medical attention is critical in such cases. Number 3. The inability to communicate or understand. During a stroke, the brain's language comprehension is significantly impaired. This can lead to difficulty in forming words and understanding spoken language, even for individuals who previously had a strong command of language. Slurred speech or fragmented sentences might also be noticeable as signs of a stroke. When communicating with someone suspected of having a stroke, you might observe a look of confusion on their face because they struggle to comprehend what you're saying to them. This condition of being unable to speak or understand language is known as aphasia. Apart from affecting speech, aphasia can also impact a person's writing, reading, and overall comprehension skills. It's important to note that aphasia may also result from the other conditions such as brain tumors or degenerative diseases. If a person starts speaking in unintelligible or nonsensical words, it is another potential manifestation of aphasia and should be taken seriously as a medical concern. In such cases, immediate medical attention is crucial to determine the underlying cause and provide appropriate care. Number 4. Numerous headaches. It's true that sometimes headaches can be innocent and caused by migraines or tension. However, when someone experiences a stroke, they might also encounter an intense headache. The key difference is that a stroke-related headache usually has a sudden onset and localized in the specific area of the brain affected by the stroke. Unfortunately, because it's not easy to distinguish between a regular headache and one caused by a stroke, people may not take these symptoms seriously, assuming they just need rest. However, it's crucial not to ignore a severe and sudden headache, especially if it is accompanied by other concerning symptoms such as vomiting, dizziness, or recurring episodes of unconsciousness with a short period. To differentiate between a migraine-induced headache and one caused by a stroke, paying attention to other sensation can be helpful. Migraine headaches often come with additional symptoms like visually experiencing flashing lights or auroras. These headaches tend to escalate in intensity with throbbing sensation that becomes increasingly unbearable. On the other hand, headaches caused by stroke typically happen suddenly and may be accompanied by other concerning signs like loss of vision and feeling of disorientation or being lost. Given the potential seriousness of a stroke, if someone experiences a sudden and severe headache with additional worrying symptoms, it's essential to seek immediate medical attention to rule out any life-threatening conditions and receive appropriate care. Number 5. Not being able to see. Loss of vision is another important early indication of a stroke. If you suspect someone might be experiencing a stroke unknowingly, it's crucial to ask them if they have noticed any changes in their eyesight. When a stroke affects the brainstem, the part of the brain responsible for visual balance can be impacted. This can lead to various difficulty in vision, such as partial vision loss, field deficits, blind spots, trouble recognizing objects, blurry vision, or seeing double. If the stroke affects the occipital lobe, the brain's ability to process visual information can be damaged, resulting in a complete loss of vision. It's surprising to know that vision loss is relatively common in stroke cases. Research has shown that approximately 60% of people who survive stroke experience some degree of visual impairment, highlighting how strokes can affect different body parts of the body in unexpected ways. Educating yourself and others about the early signs of a stroke and the FAST acronym, face drooping, arm weakness, speech difficulty, time to call emergency, can make a significant difference in ensuring prompt medical attention and reducing the potential damage caused by a stroke. For those at high risk of stroke, wearing a medical identification tag and keeping medical history updated can be essential safety measures to help healthcare professionals provide appropriate care in case of an emergency. In conclusion, recognizing the early signs of a stroke is crucial for timely intervention and minimizing its potential impact. A stroke can be a shocking and terrifying experience as it can affect the entire body and even be fatal. When someone is about to have a stroke, they may exhibit various symptoms such as difficulty in walking, facial dropping, and the inability to lift their arms properly. Language comprehension can be also significantly impaired, leading to difficulty forming words and understanding spoken language, a condition known as aphasia. One significant, often overlooked symptom of a stroke is intense headache, which can be sudden and localized in the brain region affected. Vision changes, including partial vision loss, blind spots, or complete loss of vision, can also be an early indication of a stroke. Being vigilant and proactive in recognizing the signs of a stroke, we can take steps to improve the chances of survival and reduce the potential long-term damage caused by this life-threatening condition. And that's it. Thank you for watching this video. Also, don't forget to like and subscribe to our channel.